I hear a lot in this institution from minority leaders about how their communities are targeted. But what I don't hear them talk about is how their communities are targeted in abortion. There are some stunning facts. The African American community is 15% of the country as a whole, but account for 40% of the abortions. There is a targeting going on in a lot of spaces and a lot of places. And it's going on in the abortion industry. And my friends, my liberals, Congressional Black Caucus members, they talk about fighting for the defenseless and the hopeless and the downtrodden. But there is no one more hopeless and voiceless than an unborn baby.
Over the years, I've heard some rather absurd comments from my Republican colleagues about abortion. I mean, some have compared Planned Parenthood to drug dealers, abortion factories, and the Ku Klux Klan. I've even heard a Republican lawmaker put forth the claim that if women are allowed to have abortions, men should be allowed to rape. After nearly 30 years in public office, nothing really surprises me anymore, Mr. Speaker. So you can imagine my lack of astonishment when my dear friend and colleague from Wisconsin, Sean Duffy, rolled out abortion statistics among African American women to lecture black legislators like me about defending the welfare of our constituents. You know, I don't expect Representative Duffy to understand why his comments are offensive, but what he and so many of his Republican colleagues fail to acknowledge is the underlying context behind high abortion rates in African American communities. High rates of abortion are related to poverty and lack of access to quality care. The war on women's health centers has resulted in multiple barriers to accessing quality, affordable health care, which can lead to higher rates of both unintended pregnancy and abortion. Representative Duffy's hypocrisy on this issue is as predictable as it is offensive. If he truly wants to fight for the hopeless and voiceless, he should join us.
Gentlewoman's time has expired. Thank you.